Selphyl, Vampire Lift, and fat grafting is combined into one filling substance. Which doctor in Florida specializes in this? Almost all wrinkles you see on the picture are non-existent when I'm not smiling. I would like to try the new blood fat filler with an experienced physician. The area around the mouth looks as if it's losing volume and needs some filling. Around the mouth there are wrinkles when I do not smile. Cheeks are okay. Note, I look especially horrible since I just had an upper lid lift done. Bruises still show. I look forward to advice with regard to the blood fat filler. Marianne.
Thank you for your question. You submitted a photo where you're smiling and you're stating in your question that you're looking for a combination of Selphyl or PRP with fat grafting as a solution to help you with the lines which you state are non-existent when your face is at rest and that occur only when you're smiling. Well, I think I can help you a little bit with this question. I'm a board-certified cosmetic surgeon, a fellowship-trained oculofacial plastic surgeon, practicing in Manhattan and Long Island for over 20 years. I've been using PRP, Selphyl, Platelet-rich fiber matrix, and I've been a member of the Vampire Facelift group of physicians for many years now. And I can give you a little perspective as to the logic that you're using and maybe help guide you to see if this is really the best choice for you. So, to begin with, when we are performing any type of volume correction, we don't necessarily expect that the wrinkles on the skin will be significantly changed when muscle activity is in motion. So the correction of volume has to be thought of based on the volume that is lost. So when you're thinking that you need filling to help fill the skin, but when you think of facial aging, you're losing bone, muscle, fat, soft tissue, and that includes the skin. So the skin gets thinner and the tissue below it, including the bone, also decreases in volume. So when it comes to lines appearing when muscle is active, well, what comes to mind, of course, are neurotoxins like Botox or Dysport. What you will probably benefit from to try to help the skin in terms of skin quality is something that can help stimulate collagen within the skin. I'm concerned that if you do fat grafting, you may be adding volume under the skin, but the wrinkles may not necessarily improve because the skin quality will not change that much. There is definitely a school of thought, and I've definitely observed it myself, that when you place fat under the skin quality can improve, and there's a lot of concepts about estrogen receptors and the interaction of fat in the skin, which I understand very well. But the challenge is that the face is moving. So I think that you may not be satisfied, and that would be what would concern me, if you still saw wrinkles after you had this treatment. In our practice, to help people with skin quality, we use PRP routinely. We'll inject it in the skin as well as under the skin. And like muscle building, we'll see how much things improve, and then we'll add more and stimulate some more. So I think that meeting with doctors who do fat grafting and PRP is important for you, but I think a physical exam and a dialogue as to what your expectations will be. You know, when we perform Vampire Facelift, for example, we're routinely using PRP or platelet-rich fibrin matrix, such as created with the Selphyl product, is is used to help improve kind of areas of hollow, but it's not specifically trying to eliminate wrinkles. When you do fat grafting, it is to add volume, let's say for the cheeks, or to restore volume in depressions, such as the nasolabial folds, or to even place it in the chin. There are many ways to improve volume and to improve skin quality, and finding the right combination is important. Finding the right doctor is important, but you will get a lot of different opinions from different people. But you have to kind of understand what the limitations are, and most importantly, set expectations for yourself as to what you define as success. Otherwise, if it's going to be, I think you'll be disappointed if you find yourself doing a procedure with the expectation that the wrinkles will be gone, and the wrinkles are still there, even if you have an overall aesthetic improvement. So I think you need to delve more into your options and think about the less aggressive and maybe long-term value of doing platelet-rich plasma injections alone to see how your skin improves. And of course, think holistically about, and you probably already do, about diet, sun protection, exercise, etc. But the genetics of skin thinning can be pretty aggressive and relentless. So I hope that was helpful. I wish you the best of luck. And thank you for your question.